विश्व में हमने युवाओं की IT एनर्जी के माध्यम से अपना एक रुतबा खड़ा किया है और भारत इसके बात के लिए गर्व कर सकता है। दुनिया में हम आंख में आंख मिला करके बात कर सकते हैं। और ये मेरा साफ मैं हमेशा कहता आया हूँ, IT plus IT is equal to IT. Information technology plus Indian talent is equal to India tomorrow.
Good morning, everybody. I am Karthik Sharma, Managing Editor at Elets Technomedia, and I welcome all of you on behalf of Elets Technomedia at the second edition of Digital Health Conclave by Elets Technomedia and eHealth Magazine in with partnership of Neosoft Technologies and WebWorks Data Centers. So today we are starting with the inaugural session of Digital Health Conclave, the second edition. The theme of this second edition of Digital Health Conclave is very much evident in today's scenario, which is reimagining healthcare with technology. As we all know that COVID-19 has exposed the education ecosystem of the whole world, and we have realized the importance of digital health in the era of COVID-19, and we have realized that post COVID-19 as well, the world has to resort on the digital means of healthcare more than ever. So in this scenario, when there are a lot of challenges and as well as a lot of solutions and innovations are there to be discussed, to be given a platform, to be making use in today's healthcare ecosystem. For that cause, Elets Technomedia has initiated this campaign, or you can say a series of conclaves on digital health. And this time we are doing the second edition of Digital Health Conclave. And again, the last edition, this edition also got overwhelming response from the stakeholders of healthcare and especially digital health participating in this conclave and sharing their views and ideas and the innovative work which was being done in this sector. So in inaugural session, again, a matter of great pleasure for us that we are having greats and the stalwarts of industry, the people who are working really towards innovation in digital health in government sector, whether it is from center or from state. So my pleasure is to invite and introduce all of you to our eminent speakers of inaugural session. But before that, I would like to request Dr. Ravi Gupta to please welcome our eminent panelist of inaugural session, our keynote speaker and our special addressees. I request Dr. Ravi Gupta to please welcome the eminent speakers of inaugural session.
Sure. I think my yes. Welcome everyone. Good morning. I'm Ravi Gupta. I am editor-in-chief of Elets Technomedia, and I welcome our eminent speakers. I think I am having some problem in my camera. It is going on and off. Give me a second to just Karthik, if you can just start the session while
Yes.
I'm fixing my camera. I think like it is giving some trouble,
Yeah.
but I welcome
While
all our
Dr.
eminent
Ravi
speakers.
Gupta, while you check your camera, I would like to first introduce you all to our eminent speakers of the inaugural session one by one, and then I'll invite them to speak. To start with, Mr. Abhishek Singh, CEO of MyGov and President and CEO of NEGD, MD and CEO of Digital India Corporation, Ministry of Electronics and IT, Government of India. A warm welcome to you, sir, in the inaugural session of Digital Health Conclave.
Welcome, Abhishek.
Thank you. Thank you.
Yeah, before I request Mr. Abhishek Singh to deliver the address, I introduce with other speakers also. Mr. Katamaneni Bhaskar, Commissioner of Health and Family Welfare and Mission Director of National Health Mission and Department of Medical Health and Family Welfare, Government of Andhra Pradesh. Warm welcome, Mr. Bhaskar.
Good morning, Mr. Sharma, and also good morning to all the other panelists. And thank you for having me in your panel. Thank you.
Our pleasure, Mr. Bhaskar. And I also introduce you to Dr. Seema Khanna, Deputy Director General in National Informatics Center, NIC, Government of India. Welcome.
Thank you, Mr. Sharma. Thank you.
Yeah.
Thank
Dr.
you.
Ravi Gupta, would you like to give the welcome address?
Yes. Let me welcome all our eminent speakers and eminent delegates who have joined on our 3D platform Avatar, and who can experience this event on a 3D platform. And I mean, audible, Karthik?
Yes, yes, very much.
Yes, okay. And let me just give you a brief background. eHealth, imagine we have been publishing for last 16 odd years, and this is India's first and Asia's first and the only magazine on IT in health. And our endeavor has been to create awareness about IT innovations in the healthcare sector. And today we are hosting this conclave, Digital Health Conclave. We have hosted more than 100 summits in this healthcare ICT sector across the country, across more than 50 cities actually. And we collaborated with several state and central government organizations to host events like this. So this is a two-day event where we are going to have more than 50 speakers who will be talking about various initiatives in the health sector using IT. And in this COVID-19 situation, where the role of IT has dramatically increased in the healthcare sector, both in the government ecosystem and the private sector ecosystem, this is the right time to look at what all is going on in this sector. And especially the government of India has taken huge initiatives in this e-health sector. The NDHM policy policies have come, and overall digital health is considered as an important agenda at the central level and the state levels. So this is the background in which this event is happening, and we are after passing through the second wave, and people are still talking about a third wave of COVID, and role of IT in health at this juncture is becoming more and more important. So with this, I welcome all our eminent speakers and delegates, and I hand over to you, Karthik.
Yeah. Thank you, Dr. Ravi Gupta. And before I request Mr. Abhishek Singh to deliver the keynote address, I also introduce you to Dr. Vipul Agarwal, who has joined us in this inaugural session. Dr. Vipul Agarwal, Deputy Chief Executive Officer of Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, National Health Authority, Government of India. A warm welcome to you, Dr. Vipul Agarwal. And if I request you to please on your camera.
Can you see me now?
No.
We cannot see you right now.
Yeah, I have put it on. Let me check. Where is the link?
Okay, while you, yeah, it's fine now, sir. We can see you now.
Okay, great.
Okay. So to start this inaugural session of Digital Health Conclave Second Edition, I request Mr. Abhishek Singh to please a senior IS officer and the person who is doing IT innovation from long time, but has done great work in this COVID-19 pandemic to deliver IT solutions in the healthcare sector in India. Mr. Abhishek Singh, please.
Thank you, Karthik, and thank you, Ravi, for organizing this, the second edition of Elets Digital Health Conclave. And it's always a pleasure to join events organized by Elets and Ravi Gupta for a long time. In fact, I always mention that the history of Digital India and the history of e-governance in India is almost goes hand in hand with the rise and with the work which Ravi Gupta and his organization has been doing. And I compliment you for doing advocacy for not only digital health, but all our digital initiatives for a very long time. So this really helped us in ensuring that the awareness and communications and like bringing stakeholders together, creating a platform in which exchange of ideas takes place, exchange of thoughts takes place, happens on the various e-India events and the other events that Elets does. Having said that, the topic of discussion today is very, very relevant in the present times. We all have seen how we have been battling the pandemic for more than a year now. And this has led us to many lessons with regard to adoption of digital technology and how digital transformation is enabled in almost all sectors of the economy of our lives, like how people have adopted to digital technologies. When we see students adopting the online education, not only in big cities and urban schools, but also in rural areas. When we see farmers adopting to digital technologies, when farmers using e-NAM for selling the agriculture produce, for getting information with regard to cropping patterns, we see that digital technologies have become the order of the day. And similarly, the health sector, when you talk of the health sector, there have been so much of work which has been done just in the last 1.5 years that it will be difficult to imagine the way we live our lives without these technologies to face the pandemic especially. So if you look back in say February 2020, when the pandemic began, and immediately we were struggling with the ways to find out the frontline health workers and the doctors and the health experts were looking at medical ways to tackle the challenge. At the same time, it became very obvious that this virus, the nature of this virus, the nature of this disease is such that it requires a lot of behavioral change. It requires a lot of communications with regard to what one should do, what one should not do. And I remember a meeting in second week of February when we were talking about quarantine. So last year, so quarantine right now, it may become like a term which is understood by all and we know what it means. But February 2020, we were wondering, how do we communicate quarantine? How do we communicate self-isolation? How do we communicate social distancing? So these were the ideas that we were grappling with. And then we used MyGov as a citizen engagement platform. We thought that let's create some videos, short videos, infographics, which communicates this. And so digital technology, in a very different sense, was used to start launching the behavioral change communication plan to begin with. That was the beginning part of it. Then the whole nature of this virus came in from across the world, and WHO and all. They said that another peculiar nature of this virus is that even if you get infected, you remain asymptomatic for a very long time. For almost 2 weeks, you remain asymptomatic. And during this period, you end up moving around and you end up infecting a lot of people. So this chain of infection keeps on expanding. So how do you detect this? How do you detect who has come in the chain of communication? Who are the people who are vulnerable, who have come in contact with anyone who have tested later? So again, technology came to our help, and luckily, almost everyone these days uses a phone which has a Bluetooth. So with the Bluetooth contact tracing technology, the Arogya Setu app was built, and Seema is here from NIC, who is spearheading the Arogya Setu initiative. And immediately a group of techies was brought together under the aegis of Niti Aayog, and there were engineers from the private sector, there were engineers from the government, there were academicians from the top academic institutes like IIT Madras, Indian Institute of Science, Bangalore, they all got together and they came up with a contact tracing app. And to tell you the truth, actually not one, but 3 such apps were developed. One was developed by NEGT, one was developed by the Niti Aayog team, and finally it was decided that India can have only one such app. So all the best features of this app were brought together, and the Arogya Setu app was launched on 2nd of April 2020, which helped in leading the contact tracing drive for battling the COVID-19 pandemic. So that was a major achievement. It went up to get around 50 million users in the first 10 days, and today we have almost 200 million users who are actively using this device and who are using it to keep themselves safe, who are able to get warnings with regard to if they have come in contact with anyone, and we ensure that they are alerted and they are able to self-quarantine themselves, self-isolate themselves, so that we can break the chain of spread of the virus. Then again, other initiatives that were built, like again, the entire testing data. The NIC built up a RT-PCR testing app. They built up a rapid antigen testing app. Ensured that the COVID-19 India portal was built up, where data could be collated, data could be analyzed. So this whole dashboard and ticker that we talk about, how many cases rising, how many cases coming down, this was again a COVID-19 innovation. Like, for example, we have so many communicable diseases, like we have cases about tuberculosis. But do we know how many tuberculosis cases are detected every day? Do we know which state has more tuberculosis cases? We do not. Similarly, for many other diseases like dengue and all, monsoons are coming, dengue will be there. But for COVID-19, it was of course a global phenomenon, but India also built up a digital platform in which all the cases that were detected from anywhere in the country were updated on the dashboard in real time, and people could see the trend of not only number of cases, but also number of deaths and number of hospitalizations. So this entire data was made available on publicly shareable platform, which also created a lot of awareness, like how big the disease is. Otherwise, if you don't know, until you get infected, you will not even know that there is a problem there. So that was again another innovation that was possible through digital technologies. It was possible in record time, and it did make a lot of impact with regard to how we are dealing with COVID-19. Then the other challenge that we were facing last year again was because of lockdowns and because of social distancing, because of closures, because of restrictions on movement, telemedicine became the norm. So telemedicine regulations required some amendment. That was also done in the month of April last year. And then the eSanjeevani platform built by CDAC Mohali for Ministry of Health was scaled up. Like eSanjeevani had earlier, they could only cater up to almost 5,000 patients per day. And it was primarily used for doctor-to-doctor consultation. The citizen interface was not there. So doctors at a remote location could talk to specialists in a bigger hospital, and they could consult them and get opinion and then treat their patients. But it was scaled up again in record time. Dr. Sanjay Sood of CDAC Mohali is to be given the credit. It scaled up to almost more than 5 lakh, the capability of more than 5 lakh consultations per day. And it has continuously grown. Almost all states have adopted it. We have done more than 70 lakh consultations. It's easy to connect. It's easy to get access. And telemedicine has become the order of the day. eSanjeevani has become one of the flag-bearing apps in this direction. Then, given by the directions of Honorable Prime Minister last year, the National Health Authority, again Vipul is here, who will be talking more about it. The National Digital Health Mission was launched on 15th of August last year in the 6 union territories to begin with. And what does the National Digital Health Mission do? It kind of lays down the implementation plan as per the National Digital Health Blueprint, which was architected by Ministry of Health, and Ministry of Electronics IT was an active partner there. And the National Digital Health Mission, under the leadership of the National Health Authority, is laying down the entire platform wherein citizens will be able to discover doctors, they will be able to discover hospitals, they will be able to discover health service providers, chemists, pharmacies, and access health services as a matter of choice. They can choose what doctor will be available, at what cost it is available, and they can get access to them. They can get consultations done remotely or in a person. And then whatever consultation, whatever prescription, or whatever advice the doctor is giving will be available to them electronically, which can be stored in their health locker. And DigiLocker, again an initiative under MeitY and NEGT, will be one of the first default health lockers. So electronic prescriptions, doctors' advisories, which very often lose, even educated people can't track of their health reports and all. will be available in the electronic health records format. They will be available in the health lockers, and then with your consent, you will have the option of, you'll have the choice of sharing it with any health service provider of your choice. So for example, if you have your blood reports from, say, a primary health center in Patna, and if you have an X-ray from Safdarjung Hospital, if you have a CT scan from Apollo, and if you have an MRI from, say, Max Hospital, and tomorrow for any reason, God forbid, if you need a second opinion from any other doctor from, say, Medanta or in Bombay or Chennai, if you're traveling, you will have the capability of sharing these electronic health records with the doctor with your consent and get the advice done. So this is going to truly transform the way healthcare is addressed in that. And as Dr. Arish Sharma, who is leading this initiative as the CEO of National Health Authority, says, this will be the UHI, the Unified Health Interface, in a way the UPI for healthcare. Just like UPI has integrated all the financial institutions and enabled seamless financial transactions across these institutions, Unified Health Interface will ensure health information is shareable, is available to the user, is available to the citizen, and is shared with his consent to any health service provider and get their advisory done. So this entire architecture, the entire framework that has been built has already been architected. It is being done in a very open, interoperable framework. And what it will do is that it will provide the basic standards, it will provide the basic building blocks, and on top of it, it will drive innovation in a big manner so that other techies and other startups and private sector operators will be able to build apps on top of it, and they can be able to offer health services. So the National Digital Health Mission is going to be one of the big game changer digital initiatives that we are going to see in the next year or so, and it will truly transform digital health the way we look at. It will create a lot of opportunities for a health service provider. It will also create opportunities for technology service providers who will be offering these services to hospitals who cannot have their own IT infrastructure. So it will mean a lot, not only for the citizens, but it will also mean a lot for the entire healthcare sector and the tech industry for building solutions like that. Then coming next to the other thing that I would like to talk about and then conclude is the role of artificial intelligence and the emerging technologies in addressing healthcare. We've also seen how AI has helped in helping diagnose diseases better, helping reduce the cost of diagnosis, reducing cost of healthcare. And there have been several interventions which have been implemented across the country, whether it's the Nirmaya's initiative for using AI for detecting breast cancer. Recently, X-ray Setu was launched, in which looking at the X-rays, you could detect whether it's a case of COVID-19 or not, and you would not require the high-cost HRCT services. There have been interventions in which tuberculosis has been detected with the frequencies of the cough, the sound of cough that is there. So AI has a great potential in healthcare. A lot of Indian companies, a lot of Indian startups are building AI-based solutions for addressing healthcare, and any such solution which is successful in India, because in India, whenever we build solutions, we build at a population scale. So such solutions will have a lot of applications globally, and we will be able to share those solutions with people across the country. Just like CoWIN app, in fact, the vaccination platform that has been built up, it's like one of its kind. In fact, I'm sure people will talk about it. It's one of its kind. Recently, NHA held a global convention in which people from more than 140 countries took part. And the world sees like the way our vaccination certificates are given, the way appointments are booked. It's such a seamless interface. Yesterday, I was at a hospital in Max, and the doctor was saying that he's amazed at the way the government has built kind of application, which is so simple to use, easily integrated with various apps, and the use of open APIs allows other apps to integrate with it. Like, for example, today, if you order something on Amazon or Zomato, you are able to check the vaccination status of your delivery boy because it's picking up that information with the APIs from the CoWIN database. So that is the kind of open API-based architecture that is being built in. That is being built in healthcare, and what is being done by NHA and NDHM will be a model for several other projects. Like the applications will be there in education, agriculture, skill development. So there is enough things that are going to come. So I would not take any more time. In fact, I would just conclude. We have eminent speakers from Mr. Bhaskar from AP, we have Seema from NIC, we have Dr. Vipul from the National Health Authority. Would be happy to listen to them. And once again, compliment Elets and Ravi Gupta and his entire team for organizing this conclave. So thank you, and all the best.
Thank you so much, Mr. Abhishek Singh. Dr. Ravi Gupta, would you like to comment on Mr. Abhishek Singh.
I think I must compliment Mr. Abhishek for giving a comprehensive picture of what all has happened in IT in health in the last 1.5 year, and I think the progress has been tremendous. So thank you, Abhishek ji, and thank you for all your support to Elets and us. Thank you so much.
Thank you.
Karthik.
Thank you so much, and it was really enriching to. It's always enriching to listen to your address, Mr. Abhishek Singh. We got to learn about the transformation and the way all the stakeholders are working together in terms of transforming healthcare ecosystem in the country. You explained that really well, and really great to know that. And now another very important stakeholder when we talk about transforming the healthcare ecosystem of the country, the digital way. I invite a person who is a medical doctor and an IPS officer, and currently at a very important position in the transformation of healthcare ecosystem when it comes to it comes to National Health Authority, National Digital Health Mission, the Ayushman Bharat scheme. And I would like to invite to address the audience Dr. Vipul Agarwal, Deputy Chief Executive Officer of Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, National Health Authority, Government of India. Dr. Vipul Agarwal, please.
Thank you, Mr. Sharma. Good morning to all the speakers. Good morning, Mr. Gupta. Thanks for inviting us and giving NHA an opportunity to speak. Abhishek sir has, in a nutshell, conveyed all that is being done in the healthcare ecosystem in terms of technological upgradation and what all the government of India is planning in the years to come. So my name is Vipul, and I am dealing primarily. So National Health Authority is implementing two projects, two flagship schemes of Government of India. One is the National Digital Health Mission, and second is the Ayushman Bharat, which is the world's biggest public funded health assurance project. So I, in the organization, am primarily dealing with the PMJY component, and the NDHM is being handled by my counterpart, my colleague Praveen. So I would be dwelling on the Ayushman Bharat role of technology in ABPMJY. So ABPMJY, as I mentioned, is the world's biggest health assurance project. We started this project in 2018, and this is the largest public funded health assurance project with 54 crore citizens of the country, 10.74 crore families getting secondary and tertiary care hospitalization coverage on a family floater basis. So 5 lakh rupees for the entire family or the household per year is being provided as support under the scheme. The scheme is an entitlement-based scheme, and the beneficiary database is frozen based on the SEC 2011 database, and only based on marriage or adoption or childbirth, new family member can be added. There is no other way. Next, please. Before I start dwelling on the technological aspects, because this entire scheme is data driven and a lot of technology goes into designing and implementation of the scheme. The scheme has a unique aspect of portability, which provides all the beneficiaries coverage across the country in any of the hospitals which are empaneled with us, not restricted to a state or a region. There's no cap on the family size or the gender or age. So this was a issue that we used to face in the RSBY times, which was a precursor to this scheme, that family size was capped to 5. So many of the female members were not enrolled, and that is why it was skewed in favor of the male members of the family. And it also covers the pre-existing diseases, and we last year included COVID-19 testing and treatment, and we've already provided more than 2,500 crore worth of support for the COVID in the last 1.5 years that we started these packages. Next, please. So in a nutshell, the achievement so far, we have already enrolled or created cards for 16 crore plus beneficiaries. We have provided treatment to 1.9 crore, and we are very soon reaching the 2 crore mark. 24,000 crore rupees plus have been spent in terms of the treatment, and the general medicine and surgery are the top specialties being offered under the scheme. More than 20,000 hospitals, including 45% in the private sector, are empaneled to provide the services. We have handled more than 500 crore rupees worth of portability cases, and as I mentioned, the scheme is gender neutral, and around 50% of the total benefit provided under the scheme is to the females. So IT ecosystem, I'll quickly come to this. Next, please. So we are providing services through three core modules of the IT system. One is the hospital beneficiary identification system that identifies the beneficiaries, enrolls them, registers them, and issues them card, or the Ayushman card that we say. The hospital empanelment module is another IT-enabled system wherein we provide the empanelment to the hospital based on predefined criteria, and the transaction management system handles the admission to the discharge and claim processing on end-to-end cashless, paperless basis. Over and above these three modules, we have next previous slide. So we have portals for grievance handling. All these are IT-enabled systems, and complete technological backbone is supporting these. We have probably one of the best in the world fraud control framework provided by SAS, which is the biggest data analytics company in the world. We also have a monitoring and research, and we provided feedback in terms of dashboard support to the policymakers even during the COVID times. The portability services and state IT integration also through around 30 odd the data warehouses. We are providing services to the state, and we also have a very robust hardware support supporting the entire system. Next. So if we see the ABPMJY IT framework, so the major stakeholders are beneficiary hospitals and the states and the ISA TPAs who support us. So for the beneficiaries, they access the information through various platforms that are integrated into the IT system. The ABPMJ website is providing support in finding hospital. Access of information can be done. Just 1 minute. Access of information can be done through website, and eligibility can be checked through Mera PMJY, another portal that we are providing. The beneficiary can get verified through the beneficiary identification system. Transaction management system provides treatment to the beneficiaries. For hospitals, HEM is providing the empanelment support. Hospitals are providing care and raising the claims again through the TMS. For the SHA ISAs, we are the TMS and Insights platform as well as the grievance system are providing support. So the entire ecosystem is having a very strong IT backbone, which is supporting all the stakeholders. Next slide. Yeah, so how do we monitor? So we are having two portals. One is the Insights portal, that is basically our dashboards, which are very comprehensive, state-of-the-art on Power BI backbone. They are providing beneficiary identification operations. Performance-related monitoring is being done on the platform. We are also monitoring the hospital empanelment and the transactions that are getting captured on a real-time basis. The portability services, penetration on a micro level, village level penetration, and demographics, etc. Everything is being captured through this Insight platform. We have also an impact dashboard to provide insights on the ISA TPA efficiency. The immediate alerts are getting generated for course correction, and we are also monitoring the HR deployment, whether they are as per the guidelines. If there are any outliers, if somebody is resorting to any unfair practices, those are getting flagged through the impact portal, and audits and investigations are being done, which have saved a lot of public money because we are getting real-time alerts to these dashboards. Next. So in terms of fraud analytics, we have one inbuilt radar platform, and FACTS has been developed to the SAS team. So radar is basically identifying the outliers. If the hospitals are doing some activity which is not as per the set norms, it gets flagged. So abrupt pattern of utilization, patient demographics, on the BIS front, suspicious card creation, and if the claims are getting submitted on the suspicious card, that also gets flagged to the radar. On the FACTS portal, we are getting a holistic view, and we are getting more than 50 triggers, which and all the triggers, the entire system is AI ML capable, and we are the data that is getting pushed into the system is improving these triggers on day in day out basis. So we do the risk scoring of entities, and we take actions, and also keep on alerting the states as to where exactly the action needs to be taken. And because of that, we have been able to de-empanel more than 200 hospitals, and almost 15-20 FIRs have been registered so last 6 months we have made this live. This is evolving, and probably by the end of this year this would be the best of its kind platform anywhere in the world for fraud control in the health ecosystem. Next, please. Another important thing that we are doing is on the grievance redressal front. So we have a 3-step grievance redressal mechanism that is all IT enabled. So call center is one of the inputs to the grievance redressal. We are getting complaints even through our mobile app as well as our website. So all these are getting pushed into the grievance redressal portal, and our call center manned by more than 500 employees is also providing support to COVID, and also it is we are handling the 1075 call center for COVID. The CGM RMS portal, as I mentioned, it is also 24/7, and 14555 is our PMJY helpline, on which both inbound and outbound calls are being done to take up this thing off, to monitor the grievances and address them on a real-time basis. Next, please. So on the IC front, we are managing the social media platforms on all the major social media sites for promotion of the scheme. Our website is also providing scheme-related information, guidelines, and the documents. We are sending mobile SMS to the beneficiaries on 5 occasions after their admission into the hospital till their discharge. And also we provided mobile SMSs in various other instances. For example, we provide support during COVID times, and case-to-case basis we use this SMS facility. And we also organize virtual events like Arogya Manthan 2.0. I would not dwell on the COVID because that subject I'm not dealing today, but we recently organized a COVID global conclave that sir mentioned in the opening address. Next, please. So on the capacity building front, we have the learning management system, that is entire IT framework is providing support on the LMS, wherein we provide videos, training videos, and other content for skill building and knowledge management. Video conferencing is being done with the stakeholders, including the Pradhan Mantri Arogya Mitra, which is our cutting edge functionary for providing them hand holding and capacity building support. Also, we are holding seminars and trainings for workshops for healthcare providers and the state officials. We also distribute training content through social media platforms. Recently, we have gone into collaboration with the World Bank for conducting online certification courses and this is the tripartite that we have done with the Insurance Institute of India. So all the stakeholders would get certified, and we would allow only the certified stakeholders to handle the IT systems and the stakeholder management in the days to come. We also are conducting online surveys, and online MOOC platforms are being used just like Coursera for capacity building of the personnel. So in a nutshell, technology is the core backbone aspect that supports us in implementation for not only for streamlining the processes, but also for the fraud and abuse curve, and for maintaining the cashless and paperless flow, and for faster claim settlement. And quality of care is also getting ensured only because of this robust technology platform that we are maintaining. That's it for today. Thank you very much. Thanks again.
Thank you so much, Dr. Vipul Agarwal. And there are a lot of hospital stakeholders in huge number watching this event on Avatar platform. I would request all these stakeholders who are connected or looking forward to connect with the scheme of Ayushman Bharat can put your questions in the question and answer segment present in the Avatar virtual platform, so that in the end we can ask those questions to our stakeholders. So audience, please keep on putting up your questions. And thank you so much, Dr. Vipul Agarwal. I will request Dr. Ravi Gupta to please comment on the address of Dr. Agarwal.
Let me thank Dr. Agarwal for giving a comprehensive view of the IT adoption in this whole ecosystem of schemes he's implementing. And as he mentioned, that this would be perhaps one of the biggest IT implementation in a scheme like this in the world, which is a matter of pride. Thank you, Dr. Vipul. Thank you.
Thank you so much. And now there were two important and leaders and stakeholders from central government talking about the healthcare ecosystem transformation. And now let's go to the states and take a very important perspective from one of the important states of the country. And we have Mr. K. Bhaskar, Commissioner of Health and Family Welfare and Mission Director of National Health Mission in Department of Medical Health and Family Welfare in Government of Andhra Pradesh. Mr. K. Bhaskar, Andhra Pradesh is known for innovations in technology from long time now, and you are one of the leaders in the healthcare sectors, looking after the public health scenario of the state. I would like to request you to deliver the address and let us know what sort of innovations are happening in the state of Andhra Pradesh.
Thank you, sir. I would take this opportunity again to thank the organizers for having invited me, and again, I would like to express the thanks from the state of Andhra Pradesh for having bestowed this honor on us. And as the speakers before me, Abhishek sir and Vipul sir, have spoken on the different technologies that have been emerging and have been used in the healthcare sector, I would slightly deviate from that and put one point on the table, that yes, technology is helping us, and technology is helping us to take the services to those areas and those sectors which hitherto were not accessing those services, and we were able to multiply the same resources by using the technologies. But the but is really the issue here, that unless we invest in physical infrastructure, healthcare sector is one sector where technology will take us only to an extent. It is not going to take us all the way, because I think this sector is the last sector in which the human interface will become negligible. Because even today, that human touch is required. Patients expect a doctor, the physical presence of a doctor, and they want the reassurance of a doctor, because ultimately it's their health at stake. Having said that, there is a need to invest in the health sector. In our country, in all the states in this country, also our investment in the healthcare sector has been grossly inadequate, which we, to our horror, again rediscovered during the COVID. So our oxygen infrastructure was not up to the mark. The number of beds available grossly inadequate, and the manpower required grossly inadequate, and the level of training they had to take care of such epidemics was also found to be wanting. Having said that, we use technology to a large extent to ensure that services are given to the COVID patients as far as possible, using the different kinds of platforms emerged. The one was the testing part, which the NIC developed and ICMR has used across the country, which helped us to ensure that the entire testing is known to us. We know the persons who are positive, and then we were able to use that data to track their primary contacts, secondary contacts, put them in isolation, put them in quarantine, and then admit them in hospitals and take care of them. Having said that, there was an inadequacy in terms of human resources, which now in the second wave and all, we try to overcome by recruiting a huge number of manpower. In fact, in the state of Andhra Pradesh, only during the second wave, we recruited around 21,000 new professionals into the healthcare sector in the government sector alone. And not only that, we ensure that all positions in the government sector are fulfilled. There is not a single vacancy for any position in the sector. Even with that, we felt that there was a shortage of human resources. There is a requirement of increasing new medical colleges, which we are doing. In fact, this year alone, we are starting 14 new medical colleges in the state. So to increase the manpower there, and we have increased, put in more new government sector nursing colleges to ensure that more nurses and paramedics also come into the system. Having said that, IT has been used extensively at the central government level by the states and all. One example that I can share with you and one experience from our side is that uh, what we have done is that we've integrated all the COVID services for a patient through a single call center 104. Any patient requiring any service, either for a testing service, a transport service, a treatment service, a home isolation service, a counseling service, speaking to a doctor, or psychosocial support, talking to a counselor and all, we all integrated into a single platform where people can talk to us. So we give them the services. So on the phone, online. What we have done is that we had around 5,000 specialist doctors who are at the backbone of the system, who would be speaking to all the patients. In fact, every person who is at home isolation also was being spoken to by these doctors, giving them reassurance, and we were also sending them the required medicines and all at home, and using our cutting edge staff like the ASHAs and ANMs to check on them once in 2-3 days whether they are doing physically well or not. Here, what we found that only the call center is not going to work unless a human being physically goes to them and gives them a reassurance that everything is all right. What the doctor has spoken to you over the phone, I am the person who is going to connect that. I'm going to ensure that you get your drugs. I'm going to ensure that your basic diagnostic tests are conducted, because a lot of people even today can't take their SpO2 reading. It's the ASHA or the ANM who has to do that reading and then transmit the same back to the doctor in the teleconsultation, so that the diagnosis becomes better and we are able to take decisions to keep the patient at home or to shift them to a hospital or a COVID care center as the requirement may be. So that was the experience during the COVID. Uh, and then as we are moving forward, we are investing a lot in tele-ICUs, where we found that the availability of specialists like anesthesians, like pulmonologists and cardiologists was absolutely in short supply. Very few doctors are available, so we have put in a system, and now we are revamping and improving in a way that we will be having a tele consulting or these professionals also, or a video consulting with all the vital parameters being transmitted to them on a real-time basis, so that a tele-ICU facility is used so that patients can be taken care with the limited amount of the manpower available as on today. So, having said that, the National Digital Health Mission is a correct thing that at a correct time, in the sense that a lot of IT applications have been developed both in public sector and in the private sector, but all of them are working in silos. Most of the applications don't speak to each other, so there is no mobility for the patients, and in fact, there is no mobility for the physicians also to ensure that the data is shared and they are able to take decisions. So you move from one hospital to the other hospital, you are made to repeat all the tests because the tests are not available in a form that are required for the physician. So the National Digital Health Mission and its mandate to have a digital health ID for all the patients, all the persons is the step in the right direction. In our state, we've already started work in that, and we are hopeful that by the end of March of 2022, all the 5 crore citizens of this state would be having their digital health ID, and all the digital health records will be available linked to the digital health ID, and all our facilities will be linked to it. The work has already started. The groundwork has been done. The basic work has been completed. I think we are hopeful by about March and we'll complete that. There was also one discussion that because of COVID, the entire database of the COVID was available on a digital platform, and we are able to access it and take decisions. Taking cue from the COVID experience, now the Ministry of Health, Government of India has also revamped the IDSP portal, which is basically taking care of all the communicable diseases. The data is now flowing from the sub-center level up to the district and the pan-India level. That has been strengthened now, and it has been really working well. We are now able to do a lot of analysis on what kind of diseases are happening where, why, and we are able to take preventive action. And a modification of it, and another layer, and now the integrated health information portal has also started. I'm happy to inform that our state we implemented it fully across all levels of health institutions to ensure that the data flow is there for all the notifiable diseases and we are getting information on a real-time basis. Of course, the sharing between states and at a pan-India level, taking decisions and analysis of will happen once all the states are also on board and they take care of it. And telemedicine is also a good step. And in fact, I'm happy to announce that as a state, we completed 20 lakh consultations. In fact, even today, almost 40 to 45% of teleconsultations on e-Sanjeevani happen in one state of Andhra Pradesh. This we could do because using the telemedicine, we've added certain functions to it, like ensuring that the prescriptions given by the doctors are actually door delivered to the patient so that the acceptability of patients is better and more patients are coming into the system because there is a doctor who is speaking to them and the prescriptions are being generated. Not only they are being generated, they are also being delivered at doorstep where the ANM goes to the home, delivers the medicines, tells them how to use them, and then also gives her phone number to them for any follow-up and feedback and all. So adding these kind of flavors and layers will also add value to the whole system. And moving down, we are also in the process of implementing HMIS entire across all the systems by the end of this fiscal year. So that's the entire thing is completed, and since we already have a lot of digital health records available with us as part of our the health program that we do it slightly differently. We don't go through an insurance model, but through a trust model in Andhra Pradesh. And these health records are available with us that we are linking to the National Digital Health ID. And we are hopeful that all these things will give a large fill up to the non-availability of physical infrastructure. But having said that, we are also investing heavily in physical infrastructure. A village clinic is currently being constructed. Physical building is being constructed in each of the village of the state with a residence also built in for the mid-level health provider so that she stays there. There is a clinic, there is an inpatient service also available there, and a telemedicine kiosk is also coming up in each of these village clinics so that the services are being taken up to the village level, which currently is being done only up to the PHC or a subcenter level at the best. So we are taking it up to lower than that to each village to ensure that these services are given. And we are linking that with EOCD also to ensure that the drugs availability and prescriptions and dispensation is also done at a decentralized level so that these services are available at a field level. So these are quite challenging times. At the same time, I would also say that quite exciting also. A lot of work is happening. In fact, we're building 14 new medical colleges. We are building around 400 new PSCs to ensure that there are availability of PSCs is there. We have placed, I think we are one of the very few states which has two full-fledged doctors in every PSC in the state, including urban and rural. So to ensure that the PSCs run truly on a 24 into 7 model, having completed the HR part, we are now building the physical part, ensuring that the buildings are available, the equipment is available. In fact, the COVID has also taught us that investment in physical infrastructure is required. So pre-COVID times, from around 3,600 oxygen beds, today we have come to a stage we have 44,000 oxygen beds and the paraphernalia required for that. Going forward, I think we need to invest both, not only in terms of IT infrastructure, but also physical infrastructure in health sector, so that the right outcomes, what we are expecting, come through. The layers of IT have to be built in over a physical layer of physical infrastructure, so that finally the sustainable development goals, whatever we are thinking about, we will be able to achieve in the long run. And we can, using the NDHM and the National Digital Health ID platform, we'll be able to do away with all these silos where all the systems, both government, private, diagnostic services, pharmacies, and the doctors and hospitals, everything can be truly integrated so that there is a seamless mobility available. I conclude with that. I have spoken purely from a field level practitioner's perspective. So I hope that is taken in the right spirit by all the other panelists. And I thank again the organizers for giving me the opportunity to participate in this event. Thank you.
Thank you so much, Mr. K. Bhaskar, Commissioner Health and the NHM in Andhra Pradesh. You actually gave a great picture of how on the ground digital health is taking place. And Dr. Ravi Gupta, if you would like to comment on what Mr. Bhaskar has said.
I think emphasis of Bhaskar ji on the physical infrastructure is very, very important point he has raised. And of course, unless we have more number of hospital beds, more number of hospitals, more number of public health centers, the whole IT layer cannot perform actually. So this emphasis is very, very important. And Hej also mentioning about the opening of 14 new medical colleges is a very, very good sign. And I like this statement that every PHC has 2 doctors. And this is a very, very important statement because in many of the states, several PHCs lack doctors, and there is a shortage of doctors in every state. So this initiative by AP government is very, very applauded. And thank you, Bhaskar ji, for joining us. Namaskar.
Thank you so much, and please be here with us, all the speakers. We have questions also. 5 to 10 minutes, we'll be asking questions, and before wrapping up. So I request you to be here, and I now invite Dr. Seema Khanna, who is Deputy Director General in National Informatics Center, Government of India, and as in the opening remarks, Mr. Abhishek Singh also introduced about her great work in managing Arogya Setu, which is everybody in the country knows about it and using it. And it's a pleasure to have you here, Dr. Seema, and I request you to please deliver the address.
Thank you, Mr. Sharma. Good morning once again, and I'm glad to be here today and talk about a few things that have been very close to me for the past year. 2021 will obviously go down as one of the most challenging times in our history. Today, we are talking about reimagining healthcare with technology. While reimagining technology should always be a priority for the innovators, the concept has taken on a new meaning in the context of the past year or so. I enjoyed hearing our speakers. I'm glad I was one of the last to speak. So I really enjoyed hearing our speakers today. And technology has remained at the core of our conversation. Speakers before me have spoken about effective use of technology and how it has been and will continue to be the enabler. Hence, before I also touch upon technology, which is the core topic today, I would like to change the tone slightly of our conversation today. I would like to relive the past year and a half and share my perspective on how it has evolved us as humans in addition to technologists, because we have a lot about technology we've been hearing for the past hour. We have encountered a pandemic for the first time in our lives, and the fight continues with no end in sight as of now. But like all dark clouds, this one also comes with a few silver linings, in my opinion, visible to only those that thrive on optimism. And the first silver lining in this very dark cloud is staying positive and hoping for a better tomorrow. The past year and a half have highlighted, according to me, a very few simple, rather obvious life facts. But these facts had somehow taken a back seat in our daily struggle. First and foremost, as humans, we have realized that family matters. COVID made us realize how important family is. I was actually, before coming to this session, I was reading a few articles, and I was reading a quote of Friedman. And let me read it out exactly to what he says. He says that beneath the warts and complexities of all that went wrong, we rediscovered the interdependence of generations and how much we need each other. A very profound statement. I really liked what he said. We were all forced to hit the pause button in our lives, and we got a chance to reflect and realize on how important bonding is. Family may be the best medicine at all. I mean, this is something we've been hearing, but we've realized that in the past year or so. We also now know that self-care is not an indulgence. This isn't just about the pandemic. My health is directly related to my lifestyle, my nutrition, physical activity, etc. We need to look after ourselves and build our inner resilience to fight the outer world. We had a brutal awakening and realized age does matter. We can no longer live by the statement that age is just a number. Being lonely and the concept of I need space is overrated. Everybody says I need space, but I think it's majorly overrated. The past year taught us that. Loneliness took on a new meaning when you are in quarantine and in isolation, and it hurts. It really hurts. It hurts our health, both physical and mental. Friends were missed. We really missed our friends and the feel-good factor that a simple hug can generate. We miss that. No matter how smart the phone is, technologies, it cannot replace the feel of a human touch. We became good friends with technology. My mother, incidentally, she's an 80-year-old lady, and she had never learned how to use instant messaging. And she learned it during these tough times so she could stay and talk to her brother, so that she could stay connected with him. My literate maid learned to enable her children to do online classes. Doing everything online is the new mantra. Our Honorable PM has been telling all of us to do that, but COVID kind of woke us to the fact that there's no other option. You have to go online. So we actually embrace technology at a very basic level. We also learned that being productive does not mean being chained to your chair. A productive brain can operate from anywhere. And finally, according to me, in the past year, the best brains came together and we unleashed a revolution in medicine and technology. And I'm fortunate to be part of such a revolution and a technology innovation, which most of you know by the name of Arogya Setu. I was there at the right place and I got a chance to contribute. Arogya Setu, as mentioned also by Mr. Abhishek Singh, as a concept was incubated in Niti Aayog. And soon after, as you all may know, was developed and implemented by my organization, that is National Informatics Center, under the guidance of MITI, Ministry of Electronics and Information Technology. The team also included volunteers from industry and academia, as also mentioned by Abhishek. Arogya Setu was brilliant. It's a brilliant showcase of how a nation responds in a crisis. We were all united and responded as one team, irrespective of where we came from. We forgot how to sleep. I mean, I had corona during that month when Arogya Setu was rolled out, and we forgot how to sleep. And we forgot hierarchy. Our leadership actually blended with us, and we collectively delivered on the mandate to protect our citizens. So Arogya Setu was such a brilliant team effort. Before Arogya Setu, as Mr. Abhishek also mentioned, before Arogya Setu, why was Arogya Setu such an enabler as a tool? Because before Arogya Setu, it's not that we were not doing contact tracing. Before Arogya Setu was offered to our citizens, contact tracing was very much there, but it was a very labor-intensive process and involved using the conventional manual methods, which involves interviewing identified contacts, recording their responses manually, etc. The manual process mostly relies on the ability of individuals to remember and identify their contacts. While this may be easy in some context, like within a family, friend circle, but it cannot be extended to include people you meet in passing, in public transport, etc. And no way can this process expect an individual to know the names, contact number, other details. That is where Arogya Setu came in. Arogya Setu, as you may all know, is the world's largest app, contact tracing app, and with more than 198 million registered users today. It is a standing testimony to the collaborative development approach where government and volunteers from industry and academia came together to develop a world-class technology and platform in a matter of 3 weeks. This is a feat which has yet to be broken. I mean, I have not come across any article which talks about an app which could be rolled out at this scale for a country like India in 3 weeks. It was absolutely brilliant. Privacy and security, something that has not been touched in the conversations with our speakers to a large extent. Privacy and security were bolted in right from inception in Arogya Setu. Concerns, as we all know who've been reading, concerns were raised about its intrusiveness on personal privacy, and it was compared with exposure notifications, service of other apps that do not collect location data. Since I'm here at this forum, I would like to mention that we need to understand that the requirements of contact tracing strategy differs from country to country. You cannot compare Singapore with India. It's not a one-fit solution to all. We need to include a large canvas from a geography perspective and a very sizable user base. These two aspects made the contact tracing process even more challenging. Singapore is very small, India is not. Hence, while we struggled with balancing protection measures and privacy safeguards, we ensured that user consent was the heartbeat that kept Arogya Setu kicking. No data was collected without the consent, and the privacy policy as documented was absolutely adhered to. While on Arogya Setu, I would also like to tell you about an interesting case. I mean, this is not something which is documented anywhere, but where Arogya Setu actually predicted an emerging hotspot area which happened to be right in the middle of a highway, which was about 30 kilometers from the middle of nowhere. When we kind of got this information, we ourselves were saying that this is a wrong prediction which is coming on, but then the state government was actually responsive enough, and the local authorities visited the site to verify this prediction that we had doled out to them. And they found a small little dhaba on a highway, which was frequented by many people traveling on the highway. As Arogya Setu had predicted this emerging hotspot area much earlier, the local authorities were able to trace the contacts by correlating the highway toll booth records, e-pass details, etc., and a major super spreader was averted by timely intervention. They have been, Arogya Setu is full of such success stories, and where Arogya Setu facilitated early identification of many potential COVID-19 hotspots way before the actual COVID outbreak started in many regions across India. We need to actually thank Itihas. I don't know, I'm sure many of you would have heard of Itihas. We need to thank Itihas, a subset of Arogya Setu, for these predictions, and it continues to do these brilliant predictions. Apart from contact tracing, Arogya Setu has also aided in reopening of the businesses. I don't know how many of you know this. During the post-lockdown phase, Arogya Setu offered an open API feature which was successfully leveraged by many organizations to check the health status of their employees and enable reopening of the workplaces. I'm not sure how many of you know that to address the requirement of citizens without smartphones, Arogya Setu also had an IVRS component, which was 1921, which facilitated the self-assessment for citizens with feature phones and landline. The user could call into the number and give a self-assessment, and over 50 lakh citizens were self-assessed using this tool, which has now been shut down because it's no longer required. But there was a time when, during peak COVID, when this platform was used very extensively by our citizens. The key aspect which was behind the success story of Arogya Setu was that it empowered the common man to join the nation's fight against COVID-19 and literally made it a crowdsourced COVID-19 combat tool, complementing the COVID-19 mitigation efforts undertaken by the central and the state governments. We have had speakers talk about them. The contribution of Arogya Setu in leading the nation's COVID-19 fight has been actually lauded by very many people, including the World Health Organization, World Bank, Bill Gates, and very many international agencies by renowned personalities. And I think this kind of makes it a proud moment for India. There are discussions on, and moving forward, Arogya Setu may evolve into a health app for India too. We're working towards that, and I hope we get a chance to have that conversation sooner. This was about Arogya Setu. I've spoken a lot. Abhishek also touched upon the topic. But in addition to Arogya Setu, NIC, my organization, is also, as you all know, is also the backbone for all e-governance initiatives in the government. And since its existence has contributed to almost all major digital platforms, both for G2G and G2C. However, since today the topic revolves around the ongoing pandemic, I'll mention a few key contributions of NIC, which Abhishek and Mr. Vipul also spoke about it, I think. In addition to Arogya Setu, NIC also developed and implemented the RT-PCR and RATI, the rapid antibody test, mobile apps, which all of you would have used in some way or the other when you were getting your test done. And it's been implemented in the NIC Cloud, which is a very robust ICT infrastructure, again implemented by NIC, and all government applications are hosted on the NIC Cloud. NIC's e-hospital, which has not come up as a discussion point, is another key digital initiative from NIC, which automates the hospital management and has played a very key role during this COVID time. Currently, over 624 government hospitals across the country have onboarded on e-hospital. At this time, I would also like to include another initiative of NIC, which is the NKN. I hope all of you connected to it today have heard about NKN, that is the National Knowledge Network. It is the primary network backbone across the government, both at the center and state, and has been implemented by NIC. And it played a key role in ensuring that our Ministry of Health, government hospitals, our research labs, ICMR, IGIB, NCDC, NDMA, all are connected on National Knowledge Network, and NKN ensured that they remain connected over a high-speed network and continue to collaborate on various COVID mitigation efforts for the nation. The reason why I mentioned NKN today is that network as a service, generally, we technologists tend to ignore network as a service. Since I'm also a key member of NKN, so I thought it's pertinent to mention it here, that we tend to ignore NKN as a service. Network as a service. Because network as a service in any implementation is actually only noticed when a platform goes down and is inaccessible. What we don't realize at times is that no initiative can be successful without an underlying robust network backbone. And that is why NKN needs to be appreciated, as it ensured 100% uptime during these times and empowered all the initiatives that the government took to protect the citizens. Without a network, can we even envision rolling out any initiative? We cannot. That is the prime reason why I thought this is the right forum in which I should mention that how National Knowledge Network, a silent contributor to all the initiatives which we have taken across the country, needs to be mentioned. The digital health initiatives undertaken by NIC are just a step forward towards building a digital health ecosystem in the country. With frameworks like, which has already been spoken about, with frameworks like National Digital Health Mission already in place, government has created an enabling environment for the government, private sector, and the citizens to develop a digital health ecosystem which can take Indian health sector to the next level. We have progressed today from using technology to improving patient care and the healthcare industry to impacting a society as a whole. This digital transformation in the health sector and the transformational change in the mindset of the common public in recent time has led to the acceptance of the digital health service delivery. And this translation and this transition has been quite remarkable. If COVID would not have happened, I don't think we could have seen this happening for many, many years to come. With the overall digital transformation of the health sector, data privacy and data security have emerged as the key components and remain at the forefront. Any new initiative innovation should be part of a unified health ecosystem that is interoperable and should focus on what data is collected, why is it collected, how will it be used, who will have access, how long will it be retained, etc. These are the points which we discuss in any topic, any initiative that we start, even at the nascent stage of putting it on a whiteboard. This full disclosure will keep the user well informed. He would not feel as though anything is hidden from him, and also help in building trust with the user. The connect is going to be much more. We have this upcoming personal data protection bill, which is, as we all know, akin to the GDPR of the EU, and it will, I think, have a very significant impact on the health sector. We all know, with all the key speakers before me, we all know, and it's a known fact, that the pandemic, COVID, has accelerated hospital and healthcare system innovation. It's laid the groundwork to transform healthcare. What we need now are strategies that continue to propel and push this momentum of innovation in technology. We cannot rest on our laurels, and we need to continue working on them. Technology innovation should ensure increased provider capabilities and patient access. Today, technology has empowered physicians to see patients remotely. My husband's a doctor, so I know, I keep hearing about what he's doing. He was part of spearheading the Manesar COVID hospital setup when it came up. So I've been hearing a lot about this. So doctors are very empowered today, physicians are very empowered today to see patients remotely and accurately diagnose their problems, even in the most rural areas, through telemedicine. But what next? I mean, what are the innovations we're talking about? Could we consider virtual reality? How about a virtual ICU? I mean, my husband, Brigadier Malik, is in the army. He talks about this very often. I mean, he has crazy ideas about how he could possibly help patients, which is what a very passionate doctor needs to be talking about 24/7. The possibilities of innovations are immense if envisioned right and implemented well. I mean, implementation is the key to any initiative. I mean, all good ideas would actually die a very lonely death if they are not implemented well. So we need to have the right people, the right tool, and the right thought, all coming together to form a single unified ecosystem if we want any initiative to be a success. If nothing else, COVID has made us a survivor. I survived COVID. My colleagues survived COVID. There have been tragedies, but it has taught us how to survive. The importance of innovation in technology in healthcare continues to evolve, and we cannot allow it to plateau. I mean, all the conversations that we're happening, we cannot allow this to slide. It needs to support the new challenges faced by the industry and society. With the changes in health IT over the past year and those yet to come, the question we should be asking isn't whether we should continue to reimagine and leverage technology for healthcare. More appropriately, the question should be, can we afford not to? I mean, it's a given. We need to reimagine technology. I think I've spoken enough. With this, I would like to end my address and thank Karthik and Mr. Gupta for inviting me here to share my views on this forum and wish them all the best in their future sessions. Thank you.
Thank you so much, Dr. Seema Khanna, and great to know your perspective, how you and your team worked in fighting this COVID-19 pandemic with technology. Dr. Ravi Gupta, would you like to please comment on the address by Dr. Seema?
Sure. Let me say that I am a Arogya Setu user, so I have I had installed it, and I think billions of people in the country had installed it. So we all experienced the power of technology, which is really important. And thank you, Seema ji, and thank you overall NIC and MIT for giving us this important tool. And as you have mentioned, that what has happened in the last 1.5 years in healthcare IT, perhaps would have taken 5 years or 8 years or 10 years to happen. So it has been a major jump in the IT adoption in this healthcare sector. And as you have also mentioned, that we can't rest on the laurels. We have to actually innovate more and look at how we can empower the doctors, empower the hospitals, empower the overall healthcare ecosystem to serve the citizens better. So I think amazing insights from you, and your emphasis on importance of family. I think it's so important to look at this aspect, which is critical for survival of any human being itself. So I think with this we can conclude the session here. Karthik, you can take it over from here.
Yes, Dr. Seema, thank you so much. And we would like to present a speaker certificate as a small token of regards from Elets Technomedia to Dr. Seema Khanna, Deputy Director General, National Informatics Center, NIC, Government of India. Thank you so much, Dr. Seema, for joining us. And thank you. And also I thank Dr. Vipul Agarwal, Mr. Abhishek Singh, and Mr. K. Bhaskar for joining us and sparing their time and sharing their thoughts. Dr. Vipul Agarwal, Deputy CEO of Ayushman Bharat, Mr. Abhishek Singh, CEO of MyGov, and Mr. K. Bhaskar, Commissioner Health and NBNHM. So here we close this session, and look, our audience, next session is on National Digital Health Mission. There'll be more leaders talking about it, and please stay with us. And thank you, Dr. Seema, once again. Namaskar.
Thank you.
Namaskar.